Speaker is Gergő Berke from Semmelweis University as well as the University of Pécs, and he's going to present a meta-analysis on risk of chronic pancreatitis in carriers of loss-of-function CTRC variants.
So, ladies and gentlemen, my name is Gergő Berke, and today I will talk very briefly about our meta-analysis regarding chymotrypsin C variations in chronic pancreatitis. So we know that chronic pancreatitis is a rare disease which has several risk factors. Some of them are environmental, but genetic alterations are really important as well. That's why this panel discusses it. And in fact, it's so important that in 2020, the consensus guideline mentioned that although it was voted on conditionally, in some certain patients, you should do a genetic background screening to explore it in these genes, one of them, which is chymotrypsin C. And although it has some function in therapeutic choices and prognostic value, I believe still the most important reason for this is determination of etiology, where genetics can really cause the patient's disease or not. So chymotrypsin C variations were first described in 2008, and it was a positive Jonas paper. And after that, people started to characterize what they do functionally. And although different mutations do different things to the function or the secretion, in the end, the most important thing is that they lead to increased trypsin gene activation. And that's how they contribute to the development of the disease. And where we are at today is that there are more than 90 identified variants. And that is quite a lot. So if we take a look at the clinically most common chymotrypsin C variants, we can see that aside from the G6D polymorphism, they're actually quite rare, and at most they are found in patient cohorts in about 5 or 6% of the patients. And that creates a really interesting statistical problem because we have a rare disease, we have rare mutations, and depending on the cohort sizes, people really cannot seem to pinpoint the exact odds ratio of how much they contribute to the disease development. And that is coming back to the genetic counseling, really important because you need to know whether this can cause disease or not. So our aim was to determine the effect of chymotrypsin C variants that first they alter the amino acid sequence and they cause loss of function chymotrypsin C in chymotrypsin C, but ones that are also relatively frequent, so we can do something with them statistically. And we found that there were 4 variants that met this criteria: the A73T, the V235I, the microdeletion, and the R254W. And out of these were really the microdeletion and the A73T were the ones that are returned before high-risk variants based on functional effects. So we chose meta-analysis because if you think about it, during meta-analysis, you identify the papers that have already described these variants, you pull them together, the data from them, and you can create a more robust statistics, which sort of overcomes the problems that I listed before. And people don't need like an excessive amount of patients, and really research costs that will skyrocket to really pinpoint those ratios. And you can see here our selection. And really the important thing is that we identified 14 papers that describe these variants. And if we take a look at the characteristics of these, the most frequent ethnicities were European and India, but the detected variants differed between them because the microdeletion and the R254W were more common in European patients, where the other 2 were more frequent in Indian. So after doing a global analysis on carrier frequencies, because these variants are really rare in a homozygous way, we also did some subgroup analysis in the tropical chronic pancreatitis for these 2 variants, and in alcoholic disease for the variants that were frequent in the European patients. And I'm just going to go over the variations one by one. And since this is kind of hard to see, I always written the global effect size here. So the A73T had a cumulative odds ratio of 6.5, and the effect really doesn't change in tropical chronic pancreatitis. And this is, of course, understandable because the European studies didn't really find this. So the V235I, we had a somewhat less effect size of 4.47. And again, it kind of went up in DCP, but one odds ratio up or down, I don't think really makes much of a matter when your 95% confidence intervals are this big. And the microdeletion had an effect size of 5.36, and this almost doesn't change in alcoholic chronic pancreatitis, which is a nice finding. And the R254W had the most modest effect size of 2.59. And again, it didn't really change in alcoholic chronic pancreatitis. So we had a bonus finding, as some of us like to call it, that the microdeletion and the PG60 variant actually are in the linkage disequilibrium. And we did that by looking at Hungarian data and noticed that they are found together. And after that, we reached out to our international collaborators and found out that 97 out of 98 carriers of this microdeletion had the G60 variant as well. And why that is important, it is important that they are in linkage, but why it is really important, because the microdeletion causes a complete loss of function. So the risks are not really additive here, because if you have a loss of function in the enzyme, it doesn't really matter what other variants you have with. So our conclusion is that heterozygous chymotrypsin C variants that cause loss of function approximately increase the risk for chronic pancreatitis 3 to 7-fold. Homozygous or compound heterozygous carriers, although they are really rare, we found 13 patients worldwide that had this, but they, of course, they contribute to the disease more. It is a lot, about 11-fold, but statistics here are really risky. And chymotrypsin C variants increase risk comparably in alcoholic and non-alcoholic disease, as we saw in the European variants. And we also identified the linkage disequilibrium between these two variants. Thank you for your attention, and I'm ready for the questions.
So if it can go back to the plots.
Yeah. I don't know.
If they get back. Can we see?
Coming.
Okay, I just would like to really highlight about the importance of these studies, because if you look at backward plots, maybe 9 out of 10 studies found because of no significance, no effect. They said if you go back, almost all of the studies were actually, if you look at the plots, non-significant. And only the aggregation of these kind of data showed the real effect on that. So I think this is crucially important, that this is what I reflect, that the non-significant negative results need definitely further investigations via several ways.
Thank you. Anyone else? Then let's move to the last talk.